What's up, everybody? Welcome to another episode of Puzzle Huddle with Experts. We have a fantastic guest today, Dr. Mona Robbins. I'm going to let her explain her professional expertise to us, but we're really excited to have her as we continue to expand the series. Please like this video and subscribe to the channel. And I'm going to turn the microphone over to Dr. Robbins so she can introduce herself and her professional experience to us.
Hi, everybody. How y'all doing? So yes, my name is Mona Robbins. I am a licensed psychologist and I'm board certified in clinical health psychology. Sometimes people wonder about my background. I went to HU, Howard University for undergrad. You know how to throw it in. Undergrad in psychology. And then I received my master's as well as my PhD in clinical psychology from the University of Illinois at Urbana-Champaign. Went on, did some additional work down in Georgia, Medical College of Georgia, and a fellowship out at Children's Health Dallas. And now I'm here.
You know what's critical about the HU? I'm not sure what key that's in, but it's like a HU. Like if you too flat or too sharp, it's not right. But
it's not right. You got to hit it just right.
You got to hit it just right, and you know what is there and when it's not. All right. So Dr. Robbins, restate for me what your PhD is in.
Yes. So my PhD is in clinical psychology.
All right. Now, what inspired you to study that? And if you could go like all the way back to your childhood, was there something from when you were a kid that pointed you to that?
You know, when I was a kid, I was excited about some aspects of science and talking to people. I thought that I might want to be a doctor, like a medical doctor, or I wanted to be an attorney. I felt like I had pretty good arguments and I really like to help people. That's the idea of psychology. I think a lot of folks think of when they go into the field. So then when I went to high school, I took an intro to psychology class. I really loved it. And I kind of got into a little bit of the forensic piece. I wanted to understand the minds of kind of like maybe the serial killers. Like I love Law and Order and all that. So I thought I was going to go
a lot of TV.
So when I went and majored in psychology at Howard, I was just a declared fine, just I'm going to do this, right? Straight out of freshman year. And as I got into psychology more, I learned about how you learn about people and how they interact, but clinical psychology focuses on some of what we call psychopathology or some of the general mental health disorders like depression, anxiety, bipolar disorder, schizophrenia. And as I continue to do that, I thought it was good, but I also wanted to understand context, cultural differences, like, how does depression look with young moms or older people or kids or folks that grow up in different neighborhoods? And so I started to consider context and space, and I got into medicine. I mean, this is a quick and dirty kind of description, but I went all across the gamut. So that's why when I mentioned I went to Georgia, I did this consortium study where I got my training across different settings at the universities, in the community, at a hospital, et cetera. And I really love that medicine piece, going back to that childhood about me wanting to be a doctor. And so it's probably no surprise that I ended up going into the clinical health realm, where I can talk about and help people who have different types of medical illnesses and think about, okay, if you are struggling with a particular disorder, how do you think of your coping strategies? Who are your sources of support? What do you pull from inside to help you get through that hard time? And that's what landed me now being board certified in clinical health. So I know that's a lot, but that's me.
Yeah, we're going to go back to your childhood a little bit more. But before I lose this thought, those people that are suffering with a mental health disorder, in terms of self-awareness and then the strategy to seek and pursue the help that they need, from what I've been exposed to, a lot of adults with mental health issues, they don't have the awareness of it. So how do we connect, the diagnosis, the awareness, and then put in place a structure where they can seek? So because without some awareness, it's hard to pursue the help.
I agree. It's like, if you don't know that there's a concern, you're probably not going to try to work on it or to try to quote unquote fix it, as people think of. So I think that's why mental health awareness is important, because mental health is just that. It's just like another aspect of health. Like we take care of our physical health, you go to your physician, we got to take care of our mental health and our overall wellness, right? We talk about self-care and sometimes we over talk about self-care. Take care of you, but what does that look like? It means doing things that bring you joy, that bring out that energy, that make you feel like, yes, I'm going to get up, I'm going to do something, I'm going to feel good about me, I'm going to be motivated. And so when you notice that that's starting to slip or it's just lacking, or if you start feeling those sensation of sadness that comes in and stays. Now, we all have our ups and downs, let's be honest, and we all get a little antsy and nervous, But when those feelings of like depression or anxiety or just self-doubt just stay there and puts you in that state of funk where you just can't get out of it and you're not really sure what to do, that's when you may want to check in with somebody to see if you could maybe get a little bit of help and support. And yes, our friends and families, we love them, but sometimes they don't see what we call our blind spots. They don't see those areas where we aren't as strong. They don't see those patterns of behaviors that we've been holding on to for years, where we've ended up in these bad situations time and time again. So talking to a trained professional who is separate from you, a third party who can neutrally see what's going on, may be helpful to kind of pinpoint areas that can be enhanced, give you some coping strategies, and maybe even recommend other treatment interventions, sometimes medications or other types of approaches like individual therapy, couples therapy, or any other community outlet that may be possible.
I love what you said about mental health and self-care. On the surface level, it seems like the general recommendation is to go get a pedicure, go get a massage, and and that there is your mental health and your self-care. But that's a short list, and it's not very dynamic. So what other things do you think? You mentioned just doing things that give you joy, but are there other ways we can think about mental health and self-care that is not as simple as you know go get another massage, or in some cases that retail therapy, which is not necessarily a healthy channel for self-care either.
That's right. And that can be really expensive. So, don't get me wrong. I love my outlets of my self-care with my massage, get my nails done. I change up my hair all the time. It's what I do. But we got to realize that sometimes that's just a band-aid approach. We got to dig deep and get to that wound, get to the source of the problem. And just doing these little things may not be something that sustains you. I often talk about therapy and say, what brings people to me may not be what keeps them with me. They come because someone said, hey, you should go talk to somebody, or they just think it's a good idea. But once they get in there and we start pulling back the layers of that onion, we start realizing like, whoa, there's a lot more going on. Are you comfortable with maybe talking about that? And so you got to realize that there are different trained professionals who may do more brief therapy, who might get to some of that top level stuff. And for some people, that's fine, because maybe it's just, I need to get through the stress of my job. Like, how can I figure out how to deal with my colleagues? Or how can I help my kid with this particular teacher in this classroom? I just need some skills to get me through. And then there are other people who may say, you know what? I realized I felt like this since I was in high school and I just never dealt with it. How can I dig deeper and figure out what's been going on? Because maybe this goes back to my relationship with my mother, my father, my grandparents. And so I think it's important to really give yourself the space to consider what it is that you need. And it may go beyond just covering it up with materialistic things. It may be about going to the core of who you are and making yourself better.
Yeah. What kind of self-inventory do you recommend? The older I get, the more I realize that life is just complicated and it does not get any more simple. So the things that could create stress and anxiety in your life, there just always seems to be more of them, not necessarily less of them. So what kind of self-inventory, self-assessment might a person just kind of walk themselves through to see if they're experiencing something where they might need more professional help than just taking a break?
Oh yeah, absolutely. And I love that you ended with that piece about taking a break, because sometimes we do need a break. And I'll start with that to say that, burnout, for example, is real. And some people feel like, well, I'm not going to get burned out. I'm gonna step back. And I've written some articles about burnout. And let me be honest, I've been burned out. And if you are out here doing the most and out here living your best life, trust me, you will experience burnout. But the point of the matter is, how do you work through it? How do you overcome burnout, right? And so I think the piece is to notice what's going on around you and being honest about what you can manage. Now, people often talk about balance. When we think about balance, we think of that scale. And if I, know the average person, the average mother, the average person out here moving around, you do more than two things. So if you do more than two things, that math don't be mathing. It doesn't make sense. You got to make it make sense, and you can't balance 10 activities. So the newest thing that people hear is that integration, work-life integration. How do you reprioritize what you got going on in your life? At one point, maybe it's all about you. And then you start bringing other folks into your life, like a spouse and a kid, and you got to rearrange it, right? Right now, for example, I have an infant. Yes, she's 8 months old. So that is the joy of my life. I also have a husband and I got a dog, right? I got myself too, and a career. So at some point, I have to shift things. So my infant might come to the front, take priority. Once she gets a little older, then maybe I'm able to move her into different activities. And now I might bring back some other interests of my own. Of course, my husband's still there. He needs his attention. I got to be able to figure out how to shift him in and move things around. So when you get to the point where you start feeling like this juggling act is just completely falling apart, that's when you might want to stop and say, what do I need to do to figure out how to do this better? And I'm not saying anyone's going to do it perfectly, but how can I do this better and create less stress, not absence of stress, but less stress in my day?
Yeah, what you described is certainly what I think a lot of adults experience is just the number of things that a person has to juggle and manage in order to have an effective life and have a career and a family and a kid. It just there just seems more to be there's more lines the more you mature than less.
Yep.
So if I could create some daily habits for myself, well, what might be some of the things that I could do, when I wake up in the morning to kind of do the self check or see that I'm notice if my balance is getting off or if I'm on track.
Yeah. Well, let's see. Some of the things that I've talked with my clients about include, let's see, this one I call my pit stop potty break. So we got to incorporate things that we do all the time, seriously, right? Use your environment as your cues to help you do things that are helpful. So many of us use the restroom, let's be honest, we do. And
Yeah.
so when you do, use that as a moment of reflection and stop and breathe, because that's where I guess the only place, if you think about it, where you might have some privacy, unless your toddler comes in there and talks to you. But if you're at work, if you're working from home, if you're at home, if you're outside at the restaurant, something happens and you go to an outdoor activity and you just need a breather, the restroom is one place where you can probably find a little bit of solitude. So what I say is every time you go, you just take a moment. I want you to take a deep breath in, inhale, breathe out. And oftentimes some people may include some affirmations with that. Breathe in, I got this. Let out all that stress. Breathe in, it's going to be a good day. Let out things that I do not own to be for me. And so I say that's number one, is taking time for yourself throughout the day, making it regular. The other thing is a positive affirmations, like I just said, using whatever helps to motivate you. Sometimes people will have little sticky notes that they put up around the house. Other times
Yeah.
people
Oh,
will
yeah.
have maybe a screensaver on their computer. Every time they go to that home screen, they see it. Other times people have something on that phone home screen so that they can look at it, or they save certain little adages and memes that make them feel good about themselves. Another thing I would say is every day, even if you have kids, find you some time away from them, okay? 5 minutes is all I'm talking about. I'm not saying go do a whole vacation, get
Yeah.
away, but take some time for you and take time away from everybody in your house. We all deserve and need time for ourselves. And oftentimes, and I'll share for the ladies out here, we had to be the who and what for everybody. You cannot be everybody's everyone. You have to be someone for you. Otherwise, you can't show up for nobody. Okay. So take time for you, at least 5 minutes every day, so that you can reflect and bring yourself back in. And the other piece that I would share too is overall have something to look forward to in the week. I would call it my fast forward thinking Fridays. Oh, it's Friday today. All right, right. So I had something to think about this week. I was going to do this interview, I was going to share some of this energy with you, and think about something that's going to get you through the week, just in case you're having a hard time making it.
Yeah, if I think about the things that my friends do, it's so the shower time is a good point of pause and reflection during the day. When you get a warm shower, a lot of times you get 10 minutes or something to yourself. Uh, me, I'll do this, and I think my spouse does it. That's sitting in the car when you leave work, before you go in the house. A lot of us gonna sit in the car for a moment or two.
Mhm.
Some of it's on social media, but just a moment to regroup and transition before I get out my car and deal with the stimulation inside of my home.
Yeah.
Let me have a moment. And then, thank goodness, when the weather's good, a lot of people are going out for a walk. If you can get a break from from the children in your family. Gosh, there's just, and that vitamin D is probably helpful as well.
Yeah.
Getting outside. So now that I needed to create a mental pause in my head to take me back to your childhood. So to have pursued this intellectual path in your life, what were like some of your favorite toys and books as a child?
Mm. Wow. Let's see. I would have to say toys. I had a lot of fun toys. I love baby dolls for sure. but I also like Legos. I enjoy building things. So I remember having this one Lego set that consisted of like some type of a boat, a yacht. Maybe that's what I need in my life, right? It was a yacht. I was putting together a
Could have
yacht,
been
and
a
I was
yacht.
already there. I was like, give me this. And
I
so
know they
I
had a
enjoy.
pirate ship. I don't know, but they probably had a yacht too.
I think they did. And I think that also challenges the mind and trying to like put things together, following instructions and looking at colors and shapes, and Legos, change as you developmentally change, like the big gigantic ones to the tiny little bitty ones.
Yeah.
Um, some other books that I love Dr. Seuss. I mean, I know there was some controversy before, but Dr. Seuss really because of the rhyming and the colorful pages. And what's so interesting too, taking that back, is the Dr. Seuss book, All the Places That You Will Go, or something like that. Probably,
Yeah.
butchered the title. But when I was a resident intern down in Georgia, and we finished and had our graduation ceremony, one of my mentors actually gave me that book at that time, All the
Look at
Places
that.
That You Will Go.
Look at
And I
that.
thought that was amazing. She knew nothing about my childhood, but that was also just speaking life and excitement into me for what she saw in terms of my potential of all the places that you're going to go. And the last thing I want to share too, when I think about the science part, is I thought I wanted to go into hard sciences, but shout out for those that do it, not me. I remember my mother gave me a microscope. I was like in first grade. I remember this. Oh yes, and I would dissect bugs.
Oh, you're gonna go look at some ants that off top.
I would go find some bigger ones, like them
Yeah.
beetles, go
Yeah.
outside and dig them up and look at the bugs and see what was inside. So I thought that was pretty fascinating.
All right. So you had an early interest in science. It didn't turn out to be hard science, but uh, directionally, I think you were able to find some resolution there. I thought of a different question. This isn't on our script, but when you have a friend like you in a network, in a friendship community, I'm sure your friends and family members call you for a number of things because we have this expert in our community. What are, if you had to summarize the things that people call you for, what are some of the things that people are experiencing right now today that informally they reach out to you and say, Dr. Robbins, my kid this, or my aunt this, or my uncle this? What are some of the things people reach out to you for?
Yeah, so having a psychologist friend can be good and interesting because sometimes, I have my own time that I need downtime. But
Yeah.
when I am talking to friends, one, I honestly try not to pry. I'll be honest. So those of y'all who don't get all the info from me, it's because I try not to pry because I want to shift hats. But when people do ask me, they are asking sometimes about their kids. I've had some pediatric, meaning child background when I did work at the Children's Hospital, but I don't specialize with that. But people may ask, like, do you think this is normal? Or what are some things I may want to consider with my child because they're showing this behavior, or they're not talking yet, or maybe they're having a hard time with their interpersonal skills. And I may know of colleagues who are in the field that I can maybe direct them to or give some resources related to that. The other big one is about relationships. When I worked at
Oh
the VA,
yeah.
I did
Oh
some work in
yeah.
counseling with couples. Folks want to know about relationships. And I think that's in part because, relationships are a big thing. We all want to love somebody, even if it's loving ourselves. And they may ask me questions about that. And because I'm also, in a relationship, being married and having been married this year makes 8 years. Got to throw that out there.
Oh,
But
congratulations on that.
thank
That's
you.
awesome.
Yes. So people do ask questions about that if they're dating or trying to think about, red flags that may come up because people have had past experiences of negative interactions or trauma experiences. And then the other one is just about stress overall, like coping. Oh, wow, Mona, you seem like you're always happy. I tend to be pretty upbeat most days. That is true.
Yeah.
This is me. This is how I am. But of course, I have my times where I'm just like, hey, let me turn the phone on silent. I just want to be to myself. Let me just sit back. But I think that, people give me energy. And so when I'm around them, yes, you do get to see perky me because I'm around folks and this is what I love to do. I love interacting with other people and I do share that with folks. And another piece that I love to do is to try to connect people with resources or connecting them with opportunities that's going to help them be better. And I also am thankful for having my own network that I tell folks all the time. It's like, find you a network, get you some people, you'll start a lineup or more of people that you too can turn to, because I do that as well. So I try to pass on the same energy to others.
Yeah, you talked earlier in our conversation about your PhD research and adhering to medical treatment or whatever support a person needs. So for those of us that are maybe supporting aging parents, I can imagine there's sometimes it emerges this stubbornness in the older generation and not adhering to their medical protocols. What recommendations do you have to help our community as a whole, young, middle age, or old, follow the protocols that are being recommended to us by our doctors so that we can get the treatment that we need and have healthy outcomes?
Mhm. That's an important question. So just to give a little background in terms of different populations that I have worked with. So I do have specialty in working with adults that have had different cancer diagnoses, endocrinology. So thinking about like diabetes and different metabolic conditions, people with various blood disorders. I worked with sickle cell disease, as well as patients who had cochlear implants, and the list goes on and on and on. And in that, I often will work with the patients, their families, and the physicians to think about medical adherence. That's the big one, not just compliance. Because when we say compliance, we're saying, hey, I want you to follow this rule. I asked you to do this, you do it. But the word adherence really conveys more of collaboration and community of, okay, these are the recommendations that your medical team wants to provide to you. We would like for you to follow this because we feel and know from research it's going to lead to positive outcomes. But we need to have you on board as well. How can you make this work for you? For some patients that we have, like older adults who may have had concerns with cognitive limitations like Alzheimer's, or maybe a
Yeah.
busy
Oh, yeah.
lifestyle and can't remember how to keep up with things, we talk about, again, behavioral interventions or environmental cues like, oh, everyone's walking around with a computer in their hand called their phone. Can you set an alarm? Can you put something on there that says, take your medication at 9 a.m., 12 p.m., and 4 p.m. every day? Can you set something on your calendar that tells you when your doctor's appointments are going to occur? Can you also do that with family and friends so that they can sync it across the board? Can you download an app that gives you information about medication lists or even shopping lists? Like, hey, if you're going to go to this grocery store, can you remember to buy these XYZ items? The other piece too is, what is getting in the way sometimes of people doing their part in following with the treatment recommendations? Can we figure out what that is? Is it because they're scared? Is it because they don't believe? I've worked with patients with cancer who have had to be recommended for chemotherapy, and some are like, hey, look, when I was coming up, that stuff was toxic, it's poison. I'm not supposed to take it, I ain't gonna do it. So maybe it's about the education, thinking about, is there another option? What are they wanting to do? Is quality of life more important and they choose not to do the cancer treatment because that's their right? Is it about pain management? When I work with sickle cell disease, is the person thinking that the team doesn't believe they're in pain? Do they need other types of treatment approaches? Are there other options instead of some of the medications that we see in terms of the opioids? It was a big deal with the opioid crisis and who has certain pain tolerance levels, et cetera. That's going back in history. So I think the biggest piece to bring back is, how do you tailor an approach to an individual? What's going on with that person? Whether it's a generational issue of, hey, when I was younger, we didn't do this, so I don't believe in it. Psychologists, what? This quack? I ain't talking to that person. That's nah. Versus, okay, does this person just not understand what's going on? And maybe we need to have more caregivers involved versus, hey, maybe the caregivers are tapped out. Tag me out. Give me somebody else. Can somebody else step in so that we can help provide the best care? But overall, I'll tell folks, look, if you don't have a primary care physician, also known as a PCP, your generalist, your doctor, your internist, you need one, okay? You can't just go to your specialist because they are what they are, the specialist. Everybody needs to have a doctor on deck. Why? Because something's gonna come up. Your average cold, an ache, a pain, anything, and you need to get it checked out. We need to have some prevention in our community so that we can make sure that those concerns that are small can be treated and maybe, resolved before they get to be bigger.
Yeah, I don't know if this is already happening, but you should. You're working on a book. In my head, this is a book. So if you were to write a book, and this is off the top of my, what book would you write if if you had to pick one of these things as kind of your first introduction? Because you potentially have more than one book, but if you have to pick the first
Wow.
thing that is the most exciting thing for you, or you think you could provide the most advocacy, what would you write your first book about?
Oh, wow. You know what just comes to mind? And let me just, I guess, cloud copyright this for those listening. How to do it all and pray I don't fall. Like that just comes to mind, right? I like these little catchy titles whenever I write articles. And I think that for me, that conveys this idea of, like I talked about with this work-life integration. People say, oh, I want to have it all. I want to have, the relationship. I want to have a house. I want to have a kid. I want to have my life. I want a brunch. I want that bag. I want the car. I want all this. there's things that you can have, but you might not get it all at the same time. Again, it may come at different points in your life, and you have to think about, what are you willing to maybe sacrifice, or is there a space for compromise for you or not? And I think based off of my experiences growing up, coming from single parent household, living on the south side of Chicago, living in areas where at times,
Mhm.
there were stable families, of course, but I also got to see some of these streets, and then coming through and then getting polished at Howard
Yeah,
University, because
yeah.
I'm sorry, Matt did remind me, and I'll put it out there that yes, people know that I like a good percolator. My husband is very embarrassed right now, I'm sure. But how did I get from that point to there to where I am now? And it's because I've embraced all aspects of who I am, my identity. I feel good in my skin, but there's been times where I felt differently about myself. Sometimes people will be in a space that kind of look to you left and right, and you start doubting who you are. But there is a way to have it all, but you may not have it all at the same time.
Yeah, and I know you still got that Chicago footwork in you. Well, once you get
Hey.
it, you don't really never lose it. Like you might run out of breath the older you get, but you.
That's true. That is true.
Yeah, you got a good 8 counts worth that you could probably do at any moment. So tell me, all this expertise. Now you're a mom. How does this stuff? How do you parent? How do you think your academic insight influences, and your child is young, so so you haven't gone through some of these stages yet. But how do you think your academic insight is informing how you parent?
Oh, absolutely. So I know that there's things that I know. I know research to some extent. I am more likely to look up information than the average person because I read. That's what I had to do to get the degree that I have. So if someone's telling me, hey, for example, there's a formula shortage right now, real life, right? What's going on with that? How do we know that this is true? What types of formula are in less demand or more? Is it because there was a recall? Like, I'm reading articles about that. So for me, I am going to care for my child from more of this, what we call evidence-based practice, where I'm looking up information to see if there has been information to let us know that this is going to be helpful. Of course, we trial and error. Just this morning, I was holding my little baby and kind of bumped her head. My husband was like, why you bump her head? Like, I woke up this morning and thought I was going to do that.
Yeah.
She cried. She was okay. Pat her. She's fine. I'm going to make mistakes like everybody else. But I do know that I will lean towards some of my resources that maybe I have that others don't. So it's not uncommon for me to know several psychologists. I train with them. Most people don't know a psychologist. A lot of my friends are adult psychologists, but I have a big group of folks that I did fellowship with who are children and adolescent psychologists. And so I can ask them questions about maybe things that happen when my kid comes through her different developmental stages. So I think it's a combination of just living life, learning the lessons that you're meant to learn, and also reading and educating yourself, because the biggest stress that I hear from some of my friends are from some of the grandparents, mother-in-laws, moms, etc., who come in and say, you should do this with your
Yeah.
baby. You starving your
Right.
baby. How come they not sleeping with a little bit of rice in they
Yeah.
bottle?
Yeah.
And some of that stuff is outdated in terms of what we know to be helpful, and it's no longer what we do. So I think that you should do what's best for you, but also maybe just get a little information to ensure that it's going to be what's going to be good for your child.
Yeah. So I'm gonna dip into a slightly personal concept, but I think there's some insight here, because a lot of this content is less existent for fathers. I don't think we get as much critical thinking and like PR support in terms of mental health for dads. What do you observe or support for your husband as a husband and a father, with you as his spouse, to ensure he has good mental health solutions and opportunities so he can be his best self and as your partner?
Yeah, so the dads out here, y'all need support too. You need it. Please do seek it out. If you got a guys group, I don't know, bro club, whatever you call it, like lean into them. And I think sometimes, as the dads, oftentimes, not always, but the idea of being the figurehead of the household, holding it together, having your emotions intact, that's important. But you also need to understand that emotional wellness does not mean necessarily crying. For some people, it is crying. Other times it's about understanding, moments of disappointment or frustration or anger, and how you exhibit that. And you're teaching your children through your behavior and your actions. They're watching you. So you need to also find spaces that's going to allow you to kind of like debrief. So for example, travel, occasionally maybe my husband will go, sit with the guys and, sit back and just be able to be away from all the women and talk about whatever they talk about. I don't know, have them a little drink, a little on the side and just be able to be. And so I do encourage that. And I'll check in with him to say, hey, do you need some time? It's usually me kind of needing time, but I often will say, is there something you might need? And for him, he might just want to go and sit in our theater room space and just, watch the show and say, hey, let's give me a moment. And that's his space. But I do try to check in and see what he might need. But at the same time, too, fellas, y'all got to speak up too. Y'all got to speak up. You got to say what you need. You got to ask for stuff too. And there's no shame in needing support and wanting some help. So you got life partners, utilize them.
Well, this is absolutely wonderful. I want to be thoughtful about your time, but there's certainly a third and fourth and fifth episode of this in my head and my thinking. So hopefully, I'll give you some time, a couple months to kind of regroup and clear out the thinking space. But hopefully, you'll let me have you back so I can pursue some different topics with you and share that information with our community.
I love it. Thank you for today.
Folks, if you haven't already, please like this video, subscribe to the channel so you can see our upcoming videos. Thank you so much, Dr. Robinson, for your time, and we'll see you later.
All right.